Today, we're covering a serious but potentially life-saving topic: -9 signs that could mean you have cancer. Now, don't jump to conclusions just yet. These symptoms don't automatically mean you have cancer, but they are warning signs that your body might be trying to tell you something. Early detection can be a game changer, so stick around, and we'll break down these crucial signs. But before starting this video, click on subscribe button to support me. Thank you. Sign 1. A lump beneath the skin. Let's talk about one of the most well-known potential signs of cancer: a lump beneath the skin. Now, I know it's something we've all heard before, but it's important to really understand what we're talking about here. Cancerous lumps can appear in various parts of the body: breasts, testicles, neck, or even armpits. And they're often hard, immovable, and painless. This is different from the soft, squishy lumps that might be more common and harmless, like a cyst. A cancerous lump doesn't necessarily cause pain at first, but what makes it stand out is its rigidity and persistence. For example, breast cancer is often discovered by women, and yes, men too, who regularly check their breast tissue. Doing a monthly self-exam is a great habit to get into because early detection really matters. You know your body better than anyone else. By familiarizing yourself with how your tissue feels on a normal day, you'll be able to spot any changes right away. Let me break this down with a simple example. Imagine you're going about your day and feel a firm, small lump in your breast or under your arm that wasn't there before. Maybe it doesn't hurt, but it doesn't move much either. While it could be nothing, this is exactly the kind of change that you shouldn't ignore. It's not about panicking. It's about being proactive. Pro tip: make it a habit to do self-exams in front of the mirror once a month. It's quick, easy, and could literally save your life. Any unusual lump, no matter how small, should be checked out by your doctor. It might turn out to be nothing, but when it comes to cancer, better safe than sorry. Sign 2. Changes in the skin. Your skin can tell you a lot about what's happening inside your body, and that's why changes in your skin can be an important warning sign of cancer. Now, we're not just talking about a little dryness or acne. We're talking about more serious and unusual changes, like new moles, changing moles, or discoloration in certain areas. Melanoma, one of the most dangerous forms of skin cancer, often starts with a mole that looks different from the rest. If you notice a new mole or a pre-existing one that's starting to change, whether it's growing in size, changing color, or developing an irregular shape, it's time to pay attention. But it's not just about moles. Sometimes, cancer can cause your skin to change texture or color in areas that aren't exposed to the sun. This could mean dark spots, redness, or even patches of skin that become scaly or rough. If these changes happen for no apparent reason, they could be signs that something isn't right. Here's a simple way to remember what to look for with moles, called the ABCD rule. A is for asymmetry. One half of the mole doesn't match the other. B is for border. Look for edges that are irregular, ragged, or blurred. C is for color. A variety of colors, like different shades of brown, black, or even red, in one mole is a red flag. D is for diameter. Anything larger than a pencil eraser, about 6 millimeters, needs attention. E is for evolving. If the mole changes over time, it's time to see your doctor. Example: imagine you've had a small mole on your arm for years, but recently it's grown larger and darker. Maybe it even starts to itch. At first, you might think it's nothing, but this is exactly the kind of thing you need to get checked out. Skin cancer, especially melanoma, can be deadly if left untreated, but it's also very treatable if caught early. Pro tip: wear sunscreen every day, even when it's cloudy. Regular checkups with a dermatologist are key, especially if you have a lot of moles or a history of sun exposure. Keep an eye on your skin, and don't hesitate to schedule an appointment if you notice anything unusual. Sign 3. Unexplained weight loss. Now, losing weight without trying might sound like a dream come true for some, but if you're shedding pounds without changing your diet or exercise routine, it can actually be a red flag. This kind of unexplained weight loss, especially if it's 10 pounds or more, could be a sign of cancer in the stomach, pancreas, esophagus, or even the lungs. The reason this happens is that cancer cells use up a lot of your body's energy, and they can also cause changes in how your body processes food and nutrients. So if you're noticing the weight slipping off without an explanation, it's important not to just brush it off. Example: let's say you've been eating normally, no diet changes, no extra workouts, and yet over the course of a month, you've dropped 10 pounds. It might feel good at first, but if you can't explain the weight loss, it's time to see a doctor. While it could be related to stress or another condition, rapid, unexplained weight loss can be a symptom of cancer. Pro tip: keep track of your weight, even if you're not trying to lose or gain. Sometimes the scale can reveal things your body hasn't told you yet. If you lose more than 5% of your body weight in a month without any obvious reason, consult your physician. Stat alert. According to the American Cancer Society, 40% of cancer patients report unexplained weight loss as one of their first symptoms. Sign 4. Persistent bloating or abdominal discomfort. We all experience bloating from time to time, maybe after a heavy meal or during a certain time of the month for women. But when bloating becomes persistent, it could be a sign of something more serious, like ovarian, stomach, or colon cancer. Persistent bloating is more than just an annoying, uncomfortable feeling. If you notice that your abdomen feels consistently swollen or full, especially if it doesn't go away after a few weeks, it's important to take it seriously. Example: imagine you've been feeling bloated every day for the past 2 weeks, but it's not tied to your menstrual cycle or what you're eating. If this is accompanied by symptoms like abdominal pain, pelvic discomfort, or feeling full quickly after eating just a small meal, it's time to get checked. These symptoms can be early signs of ovarian cancer, which is notoriously difficult to detect early. Pro tip: keep a diary of your symptoms. If you notice persistent bloating or discomfort for more than a couple of weeks, and it's not related to anything obvious like food or your cycle, make an appointment with your doctor. Mention any other symptoms like changes in bowel habits, which could also signal a bigger issue. Sign 5. Wounds that don't heal. We've all had cuts and scrapes that take a little while to heal, but if you notice a wound, sore, or ulcer that just won't go away, it could be a sign that something isn't right. Wounds that don't heal within a reasonable time frame, usually a couple of weeks, can be a symptom of skin cancer or even cancers inside the body, like mouth or throat cancer. Your body's immune system prioritizes its resources, and when cancer is present, it diverts a lot of energy to fighting the cancer cells, leaving less energy for healing things like cuts or sores. So if a wound or sore is taking longer than usual to heal, especially if it's in areas like the mouth or on the skin, it's time to investigate further. Example: imagine you have a small sore on your lip or inside your mouth that just doesn't seem to heal. Maybe it's been there for 3 weeks, and instead of getting better, it's staying the same or even getting worse. This could be a sign of oral cancer, particularly if you also notice red or white patches, pain, or difficulty swallowing. Pro tip: keep an eye on any wound that hasn't shown signs of improvement after 2 weeks, especially in areas like the skin or mouth. If it's not healing, call your doctor. They may perform a biopsy to rule out skin cancer or other conditions. Stat alert. According to the Skin Cancer Foundation, 60% of skin cancers are found because of persistent sores or lesions that don't heal properly. Sign 6. Changes in bowel or bladder habits. We all know that our bathroom habits can tell us a lot about our health. When something changes dramatically, whether it's how often you go, the consistency, or the appearance of your stool or urine, it could be a sign of colon, bladder, or prostate cancer. If you're experiencing chronic constipation, diarrhea, or notice blood in your stool or urine, these are signs you shouldn't ignore. For instance, colon cancer can cause narrow stools, while bladder cancer may lead to bloody or cloudy urine. Sign 7. Persistent cough or hoarseness. A persistent cough or hoarseness that won't go away could be more than just a lingering cold or allergy. If you had a cough for more than 3 weeks, especially if it's dry and persistent or accompanied by blood, it could be a sign of lung, throat, or even thyroid cancer. A lingering cough is your body's way of telling you something's wrong, particularly if you've never had issues with respiratory problems before. Hoarseness or a change in your voice can also point to throat cancer, especially if there's no obvious reason like a cold or overuse of your voice. Example: let's say you had a dry cough that just won't quit, and it's been going on for more than a few weeks. You might notice that your voice sounds different, or you're coughing up small amounts of blood. These symptoms can be serious warning signs of lung cancer, especially if you're a smoker or have been exposed to secondhand smoke. Pro tip: don't let a persistent cough or voice change slide, especially if it lasts more than 3 weeks. If your voice is hoarse and you haven't been yelling or sick, or if you're coughing up blood, make an appointment with your doctor right away. Sign 8. Persistent fatigue. Feeling tired after a long day is normal, but persistent fatigue, The kind that doesn't go away no matter how much rest you get, can be an important warning sign of cancer. Unlike regular tiredness, cancer-related fatigue is overwhelming and often isn't linked to any physical activity or lack of sleep. It's more like an all-consuming exhaustion that makes even simple tasks feel impossible. Cancer, especially leukemia, lymphoma, or cancers affecting the blood and bone marrow, can cause this type of extreme fatigue. This happens because cancer cells use up a lot of the body's energy and can disrupt normal blood cell production, leading to anemia, which can make you feel incredibly drained. Example: imagine waking up after a full night's sleep but still feeling like you've barely rested. Even climbing a flight of stairs or walking around the house feels like too much effort. This isn't the normal tiredness from a busy day. It's something deeper and more persistent, and it could be a sign that something serious is going on in your body. Pro tip: if you're experiencing fatigue that lasts for several weeks and it's impacting your daily life, it's time to talk to your doctor. Persistent fatigue could be caused by many things, but when it's tied to cancer, it usually doesn't improve with rest or lifestyle changes. Sign 9. Difficulty swallowing or persistent indigestion. While difficulty swallowing, called dysphagia, or persistent indigestion might seem like minor annoyances, they could be warning signs of throat, esophageal, or stomach cancer. If these symptoms stick around for more than a few weeks, they should not be ignored. With throat or esophageal cancer, patients often experience a sensation of food getting stuck in their throat or chest, and in more advanced cases, it can become painful to eat or drink. Persistent indigestion or heartburn can also be a sign of stomach cancer. If you find yourself popping antacids regularly and the discomfort just isn't going away, this could be a sign that something more serious is going on. Example: imagine sitting down to eat a meal, but as soon as you take a few bites, it feels like the food isn't going down smoothly, or you have a burning sensation in your chest. You might brush it off as indigestion, but if this keeps happening, especially over a few weeks, it's time to get checked. Pro tip: if you've been dealing with persistent indigestion, heartburn, or difficulty swallowing for more than a couple of weeks, especially if it's getting worse, see a doctor. These symptoms are often overlooked, but they can be early indicators of digestive cancers. If you enjoyed this video, please hit the subscribe button and click on the bell icon for more informative videos.